Hello, so this is about MAS Community Health. Our vision. MAS Maine Community Health envisions a statewide presence focused on helping individuals and families build natural supports to enhance their quality of life. We provide innovative therapies and exceptional service by listening and adapting to the needs we see in the communities we proudly serve. MAS Maine Community Health provides a full range of services in the community, in client homes, at school, and at any of the MAS Maine office locations. MAS Gives Back. MAS Street Team is an opportunity for MAS Maine to volunteer and give back to its local communities. Our volunteers' focus is the Essentials Pantry. Volunteers forge ahead, collecting and distributing essential household items such as diapers, soap, shampoo, and toothpaste for those in need. If you or someone you know needs these belongings, our Essentials Pantry is based out of our Westbrook office and is located at 21 Saco Street in Maine. Essentials Pantry pickup is Monday through Friday between the hours of 8 a.m. and 4 p.m. while supplies last. MAS Maine promises that we will not rest until every family in Maine has what they need, whether it's be an opportunity for employment or services through one of our exceptional providers. Focusing on children's mental health. Children's services focus on behavioral health treatment and services for children from birth up to their 21st birthday. Children mental health services and children behavioral health services for children and youth with developmental disabilities, delays, intellectual disabilities, autism spectrum disorders, and mental health disorders are eligible for children's services. Family-based services. HTCT is an intensive family-based service which is available to children with particularly challenging behaviors. Often the children has tried outpatient counseling and did not get the results needed for the family to have harmonious relationships. An HCT clinician works with all members of the family to address problematic behaviors. A BHP, or behavioral health professional, will also work with the identified child and the parents to practice the skills the family is learning from the clinician. Therapy is most effective when a partnership is made between children, parents, caregivers, and providers. Therefore, parent participation with both the HCT clinician and the BHP is required. This service is offered several hours per week within your home. Additional hours may occur at the children's school, within the community, or at your local MAS office. This service typically lasts 6 to 9 months. Hello, so this is Case Management Services for Children. MAS Community Health offers a family-centered, community-based mental health and behavioral health case management service for children with an identified mental or behavioral health condition, or for young children at risk of developing one, who are in need of specialized services. The targeted case manager will work with the family to identify appropriate resources, make needed referrals, facilitate treatment team meetings, and coordinate essential services to ensure your child's well-being and to maximize their development. TCMs will meet with your family at least once per month in your home to monitor progress and continually assess needs. This is a time-limited service that is available when a child needs to be connected to supports, resources, assessments, and treatment services. Rehabilitative and community services. Rehabilitative and community services, RCS, is for children or youth up to the age of 21 who have a developmental disability or a diagnosis of autism spectrum disorder that affects their everyday functioning. Our team utilizes certified behavioral health professionals to work on skill building in both daily living and behavioral management to support the child's functioning in the home and out in the community. Behavioral health services. Section 28 for children. Community support services utilize a behavioral health professional to provide direct skills instruction to children with an identified developmental, behavioral, and mental health disability, which is having a significant impact on the child's functioning. This service is designed to improve the skills and behavior of qualifying children to maximize independence, facilitate community access, and enhance social relationships. Mental health outpatient services. MAS provides outpatient therapy to clients who are requesting therapy and/or have been referred for therapy. Adult outpatient therapy includes evaluation, diagnosis, and treatment to individuals, dyads, and groups. In order to meet the criteria for outpatient therapy, the client seeking outpatient therapy will have either a mental, a behavioral, or emotional disorder that meets medical necessity requirements and results in functional impairment, which interferes with or limits the individual's ability to function effectively in the community. Licensed professionals at MAS use evidence-based practice and trauma-informed care in order to provide clinical assessment, counseling, and medically necessary therapeutic services to adults living in Maine. These services are intended to address symptoms which may be adversely affecting mental health and to improve overall functioning. Diagnostic assessment appointments are also available in order to determine eligibility for other MaineCare covered services. MaineCare and self-pay accepted. Adult case management services. MAS provides adult case management services for mental health, including case management for homeless adults experiencing mental health challenges. Case management services are intended to provide assertive, consistent engagement to build rapport, assess needs, coordinate referrals, and advocate for access. Case managers continually monitor the efficiency of all services. Mental health home care. Daily living support services are intended to assist those struggling with severe and persistent mental health challenges. Our services provide individualized therapeutic supports to assist the person in maintaining the highest level of independence possible while remaining in their homes and communities. DLS supports individuals with anxiety reduction, mood elevation, developing and using self-awareness, appointment attendance, health maintenance, household organization, menu planning and meal preparation, communication skills, problem solving and decision making, being part of their community, exploration of meaningful activities, including work, education, and other interests, financial management and budgeting, and accessing transportation. And finally, we're here to help. Thank you for your interest in MAS Community Health. There's a referral line here, a Northern Maine number and a Southern Maine number.